A very good day to everyone. I am Professor Dr Mala Dharamligam. Today I am going to tell you a little bit about the coronavirus. Now, what is this coronavirus? Just like there are many viruses which cause respiratory infection, we have a new virus which is called the COVID-19 virus or the coronavirus. Now, why are we afraid of this virus? Much earlier, we did have the coronavirus, but this strain of coronavirus is absolutely new. We don't know how it spreads, how long it stays, and what are the treatment for this. So that is why we are very worried about this new virus. Now, why is it that diabetic patients will be getting more of this virus? In diabetic patients, the glucose fluctuation as well as the lower immune levels that they have make them opportune candidates to get the coronavirus. So it's very important that they understand and know everything there is to know about this new coronavirus. Now, the first thing that comes into mind is, how do people get infected? This coronavirus is just like every other respiratory disease that I told you and is spread by air droplets. Now, these air droplets get contaminated from one person to the other by talking, sneezing, coughing, or in any form in which this air contains droplets of this virus. It could be mild and pass off almost without any symptoms or much symptoms. It could be severe, in which case it can cause severe problems including cough, fever, respiratory distress, or shortness of breath. So it's very important to understand. So many people will get just cough some of the time. So should I rush to the hospital? No. One should self-quarantine and see if the symptoms are getting worse. And if the cough comes along with fever or shortness of breath, yes, then one has to go to the hospital. When will these symptoms occur? Usually the symptoms occur within 3 to 7 days of exposure to a person who is tested positive or is positive. Maximum 14 days. So within 14 days, if you have no symptoms, then most likely you have not got infected. But in case you have just cough, please self-quarantine yourself for at least 14 days. And if you're not better or you're worsening, then definitely go to a hospital rather than go to a nearby clinic. So in this self-quarantine period, what am I supposed to do? Yes, all the diabetics, please listen very carefully. You should drink lots of water. Hydration is a must. You should do moderate exercise and eat healthy. This is very important. Lots of fruits, lots of vegetables is mandatory. Keep some simple sugars with you in case you go into hypoglycemia. Now, I am diabetic. I'm worried that I will get. What should I do? Please wear the mask. The prevention of contact with air droplet is the most important. The second, do social distancing. Don't go very close to people, at least 3 to 6 meters from persons we don't know. He may be a healthy carrier and they may not have symptoms, but they may pass it on to you. Keep stock of all your medicines and see that you have all your medicines. There are some tablets like the SGLT2 inhibitors. In case you become symptomatic or dehydrated, you can stop those medicines and take some other medicines. But all other medicines, including insulin, should be taken, and the frequency of testing should be done frequently at home. Now there are some sick day rules which every diabetic should know. What are these? Please drink plenty of fluids which are glucose free, sugar free, lots of water, and please check your blood glucose regularly, check your temperature regularly. All these things are very, very important. And of course, the most important is to keep your contact information of your doctor in case you need to clarify your doubts and see that you are not getting infected by staying home and staying safe. In case you have the disease, there's nothing to worry too much. Go to a doctor. You need to take proper treatment. It's all preventive treatment. As you know, there is no cure. When the symptoms get worse, go to the hospital, get admitted. There they will symptomatically treat you. Here, most of the time, it is because of low oxygen. So oxygen may be given in various forms, either in the form of a ventilator or even in the form of ECMO, which is the membrane oxygenation. So there are many methods which the hospital will do to see that your oxygen levels are maintained. So friends, please be advised to stay home, stay safe, and see we will conquer the virus still. Thank you very much.